Hi everyone, today we're going to be covering treatment for GTPS, otherwise known as Greater Trochanteric Pain Syndrome. Hi, my name is Desiree, and today we're going to be talking a little bit more about what treatment might look like for this condition. So before we get started, let's chat a little bit about what Greater Trochanteric Pain Syndrome really is. So Greater Trochanteric Pain Syndrome is going to be pain along the outside of the hip here. Some of you that are watching this video are probably experiencing discomfort along where that hip bone sits. It's usually like a deep, kind of stabby pain that you feel. A lot of times people will feel this pain or discomfort when they're doing things like going to lay down in bed at night, and just laying on that side creates that discomfort for them. So they're tossing and turning, you're losing sleep, all of those things that come along with pain when you're trying to fall asleep at night. Another issue that people have with this condition is the pain in the outside of the hip that's deep into the hip oftentimes gets annoying when you're doing things like going for long hikes. You are climbing up the hill and you are afraid you're not going to be able to get back down because the pain is so bad. Those are really extreme examples, but they are some of the examples that people with this pain experience. If that's you, you're in the right place because we're going to be covering some of my favorite treatments that we can do there. One of the treatments that we like to use here in the office is actually called skin rolling. And as the name implies, you're just going to be rolling around over the skin. So I'm just going to show you a quick little example of what that's going to look like. Now this might work for some people. Some people notice that this is like the cherry on top. So there are other things we need to do in order to find that release before this might actually work. Some people will go through this, and as they're going through it, they notice an instant relief. Whatever category you fall into, that's totally fine. But we will go over a little bit more of how to do this to decide if this is even right for you. So if you have the pain here, I want you to find that pain. It's usually around where that hip bone starts, and you are going to find a good scruff of skin that starts along the spine here, and we're going to travel down around this region. So we are going to go ahead and grab a piece of skin. I like to say a decent chunk, like you're scruffing a dog, and you're just going to roll over the area here, work your way down around in front, hang out there. If you find that tender spot, there's always a money spot is what I like to say. When you find that money spot, spend some time over that area and start to move around with it. Okay, and usually you'll know because you'll jump around or you'll make a face and then you know you're in the right place. Go through that. I usually say spend about a minute here going through this, and then check out your hip again. So a lot of times people with Greater Trochanteric Pain Syndrome will have a lot of pain or discomfort when they're sitting in a cross-leg position, as I'm in here. This is a good way to kind of test, reassess, or you can do things like reassess laying down on your side. If you notice there's a different, awesome. This is a really simple treatment that you can do at home. Just be advised that this might not be the only thing you need to ensure long-term relief for Greater Trochanteric Pain Syndrome. Oftentimes, when you have Greater Trochanteric Pain Syndrome, you're going to need a little bit more than just skin rolling to feel better. It might entail things like strength training. So we might do exercises such as glute strengthening exercises like we've covered in some of our other videos, or you might see in our webinar. But you'll go into things like a glute strengthening exercise, priming that glute, working that glute, because oftentimes pain is just it's a symptom because something else is not doing its job. So if any of these things resonate with you, check out the webinar up above. You can play around with some of the exercises in there. If you feel like you're stuck and you still need a little fine tuning in your program, give us a call. There's a little form here that you can fill out, which we can reach out to you and help you customize your care plan, because everyone's treatment is going to look different just depending on what symptoms you're presenting with.